So those of you who were here last year were treated to a panel and the participation of 3 members of the Birth Parent National Network. Corey Best, Janelle Moss, and Sandra Collette. Hopefully many of you remember them. They were participating throughout the conference and were a big part of this effort last year. The Birth Parent National Network is a joint effort by Casey Family Programs and the National Alliance of Children's Trust and Prevention Funds, of which I'm a board member. So we're very excited about that. The Birth Parent National Network was created to provide a voice for birth parents whose voice is too often left out of the conversation around foster care and child well-being. Our speaker, David Sanders, was very instrumental in supporting and promoting that voice and has made that a big part of his career, which is having a profound impact on child welfare policy and practice throughout the country. David Sanders really came to my attention, though, as the chair of the Commission to Eliminate Child Abuse and Neglect Fatalities, a congressionally created commission that held 11 hearings around the country to better understand the causes of child deaths caused by child abuse and neglect. David Sanders was universally lauded by our colleagues, people who work around the country, throughout the country, for his even-handedness and passionate voice for families and children. David will be joined by Maritza Lorenzana, who is a social worker at the Veterans Administration in Boise, and a former foster youth who continues to fight for and mentor current foster youth. You can read both David's and Maritza's bios in the program with all those great bona fides they have. We've done some great work, great stuff. But for now, let me just welcome Maritza and David to the podium, and thank you very much for being here.
Good morning. Thank you, Roger. Good morning. I'm amazed at the crowd. This room is full. It's really something to see. I'm honored to be here. I'm humbled, especially after seeing all the hands go up with 15 years of experience or more, and Roger's comment that people in the audience knew more than any of the speakers. I'm going to see if I can live up to that. And actually, in a lot of ways, the poem that Roger read, I mean, it's going to take me 30 minutes to say what the poem said in a few lines. That was really remarkable, and I think speaks volumes about the work that we need to do and the work that we are doing. And I know the work that you're doing from the things that I've heard. And I am really excited to be in this beautiful state. Actually, this is my very first trip to Boise. But I've been to Idaho regularly. I've just missed the big city, and it's I am amazed every time I come here by the beauty. And so, thank you for inviting me. I'm David Sanders, as was mentioned, and at Casey Family Programs, I'm responsible for our work with states and our work on federal policy. And so, I'll talk a lot about just some of those experiences, as well as the experience that Roger mentioned with the commission and some other things. You can go to the next slide, Marty. For those of you unfamiliar with Casey Family Programs, we're actually the nation's largest operating foundation that focuses exclusively on foster care and child welfare. We have an office here, as many of you know, and there are a number of Casey staff here. Maybe if you can stand up just briefly so that you can be recognized, please stand. And my hope for our time together this morning is to set some national context for this notion of we're all in it together. To talk about our approach to protecting children, but specifically want to talk about 3 things. First, I will talk about how we got here, a little about the history that helps to define the work that we're doing now. Second, where we are today, and I'll use some data and other information to really, at least from my perspective, to put forward the notion that our current child welfare approach isn't making things better for children. And it may challenge some of the conceptions that some in the room have, but I think it's a worthy challenge given the kind of outcomes that we see for children that have been in the child welfare system for extended periods of time, and in fact, many of the children who are in the child welfare system. And finally, talk about the type of changes that we need to make to actually improve the safety for children moving forward. And I'll talk a lot about some of the impressions from the commission, but also some of the work that I've had an opportunity to see around the country, and some ideas that hopefully will be relevant for you. One thing that is very clear is that states are different, counties are different, communities are different, and so much of what I present will be from the perspective that I've had over time. All of you have developed a perspective and also know the work in Idaho much better than I do. So I think listen for the things that apply and question me for the things that may not. I want to start, though. Sarah mentioned that many of you never get thanked for the work that you do, and I want to start by thanking you. Roger thanked you. I want to do the same, because from the work that I've had an opportunity to be part of, I would say the most important thing that we can do is to prevent abuse or neglect from occurring in the first place. And I think anything short of that is failing our children and failing the promise that we should make to our children that they have a basic right to safety, which in fact in the United States they don't have a basic right to safety, which I think is one of the real challenges. But I think that those of us in the room who are committed to this really have done a remarkable job in making sure that children's lives are better. And I think you'll hear in the comments from Maritza how much the work that you do is valued and how important it is. So thank you for all that you do. I'm also, as I mentioned a couple of times, honored to be presenting with Ms. Lorenzana. And she brings an interesting and different perspective than I do. She's a foster care alumna, she's a social worker, and she's a mother. And she also cared for her relatives. And so you'll hear a number of different perspectives. And actually, when I was asked to speak, one of the things that I said was important was that I had to bring somebody here who could speak from the perspective of having experienced the work that all of us do in a way that I never have. And I can get up here and say all these great things that actually mean nothing to people who are being served by us who have committed our lives to this. And I really wanted somebody to both challenge, to validate, and to also bring their own perspective. And Maritza will do that a little later. So I'm going to shift and start with the first part I want to talk about, which is a history, kind of how we got here in child welfare in the United States. You can go to the next slide, Marty. So child welfare in the U.S. has really evolved in three philosophical waves. Next slide, next slide. From our earliest days, actually I think back a slide, forward a slide. From our earliest days in the 1600s to the 1800s, parents were seen as the absolute authority. Parents set the law for their family, and in fact in Massachusetts, the stubborn child law made it illegal for children to disobey their parents' demands. Oh, I long for those days. Then we moved to the child rescue phase in the 19th century. Child labor and education laws were established. Children were, quote unquote, rescued from the streets and removed from their families. And many were placed in orphanages to receive, again, quote unquote, a proper education. Many were sent west from coastal cities to frontier states on orphan trains, where they ended up providing farm labor and welfare, often separated from their siblings, their native language, and their culture. Next slide. And finally, we move to the state as parent phase, where government has a much greater role in the lives of families, which is really where we are today. In the early 20th century, we saw government step in with the very first Children's Bureau, the Federal Children's Bureau, to address child safety and well-being. In 1935, the Social Security Act set up aid to dependent children and child welfare services. Then in the 1960s, Dr. C. Henry Kemp published The Battered Child Syndrome, and by the mid-60s, states mandated reporting suspected abuse. So it's really not a long history of mandated reporting in the child protection structure that we have. And I would argue this is also when we chose to isolate child safety from families. So unsuitable homes became unfit parents, largely as a way to prevent financial support from going to unwed mothers and to parents of color. In the 1970s and 80s, child welfare agencies transformed from foster care agencies to child protective service agencies. Native American families in particular were broken apart, with children sent to boarding schools where they were not allowed to speak their native languages or follow their cultural practices. This eventually led to the Indian Child Welfare Act in 1978 as an attempt to address the alarmingly high percentage of American Indian families that were being broken up and by removing their children. Next slide. Our current child protection system has also focused spending on the primary intervention of foster care. Foster care was really designed to provide an emergency, time-limited intervention for a child who's not able to remain safely at home. And that remains a laudable goal and is a perfect use for foster care. However, as we look today, the intervention is used in a very different way, where it becomes a long-term destination for many children versus the short-term intervention. In addition, the foster care intervention was designed largely in response to child fatalities and serious abuse. It was intended to serve the children who are at the highest risk for future abuse or for serious harm. It was not designed to handle the millions of referrals received each year involving neglect. About 80% of the children who enter foster care do enter because of neglect or other causes, not because of abuse. And so we have a system that's really designed to deal with a very different population than it's dealing with today. Next slide. So that's just a bit about the history. Now let me switch to talk a little about where we are today. And this is not going into a lot of detail, but just to give a general picture. Next slide. Oh, got there. So nationally, we know that 3.4 million children received a Child Protective Services investigative response in 2015. And that number's up about 10% since 2011. About 683,000, or about 20% of the 3.4 million children who received an investigation or assessment were confirmed as victims of abuse or neglect. And that's up about 4% since 2011. But think about what I said earlier about a system that's designed to deal with abuse. 3.4 million calls turns into a little under 700,000 actually confirmed victims of abuse. And so there's a lot of investigating for very little benefit for a number of families, and I'm going to come back to that. And as you can see in this chart, after decreasing for several years, the number of children in foster care started to increase again. It's about 413,000 at the end of 2015, which is up about 8% since 2012. And we know that neglect and parental substance abuse, based on reports from states, are the two most common reasons that children under 5 enter foster care. And for many parts of the country, we're dealing with an alarming rise in opioid use and addiction. And I'm sure that some of you here are dealing with that. Over the last few years, the children entering care has increased, and it's likely that the opioid epidemic factors into the increase in neglect that we're seeing. And I mentioned earlier this separation of child safety from families, because that's the underlying philosophy of foster care, the belief that you need to separate children from their families if they are at risk of harm. And the earlier decline in the number of children in foster care was encouraging, because it seemed to suggest that there may be ways to keep children safe in their own families, and perhaps prevent abuse or neglect from happening in the first place, or prevent a recurrence of abuse or neglect from happening. But now, as more children are entering foster care, we're seeing, and fewer exiting, I believe that we will see increased risks for all of us, both in terms of system capacity, and I know the things I read here in Idaho are about caseload skyrocketing, insufficient number of foster homes. Perhaps it's connected to this idea that we have disconnected foster care and disconnected family and safety. Next slide. Finally, and I'm going to come back to this in a little while, 1,670 children died of abuse and neglect in 2015. That's more than 4 children a day. And while it's a small number relative to the total number of children served in the child protection system, it really is, in my view, what drives public opinion about child welfare services and services to children in general. Many of the policies that are set are determined by a particularly heinous child fatality, and those fatalities live in the heart and minds of many communities for years. Prior to coming to Casey Family Programs, I was the director of Children's Services for Los Angeles County. And Los Angeles, as all of you I'm sure know, is a big county, a very big county. And the number of child fatalities is high. It's a violent city, and there are certainly particular parts of the city and the county that are quite violent. But the policy that's been set on child protection and child welfare in Los Angeles is really driven by a handful of child fatalities that really capture the imagination of the community. And one of the opportunities that I ended up having after having left there as director was to actually chair a commission in Los Angeles looking at the services to children and families in the child protection system after a particularly horrendous child abuse and neglect fatality of a young boy named Gabriel Fernandez. And I will come back and talk a little about that, but the impact on communities of child fatalities is incredible. And so this number of 1,670, I think, really underestimates the impact that each of these fatalities has on policy in this country. Next slide. Now, despite what I've just shared, I actually think the work that many of you in the room are doing has produced some improvement in outcomes, and that we are better at serving children today than we have ever been. And I think, again, that's a testament to the commitment and dedication to the people in the room. So safety is one critical indicator of how we're doing, especially as systems work to reduce the number of children in care. And the best measure we have on safety is the percent of children who have a repeat occurrence of maltreatment in 6 months to a year. And while Roger is correct, it's very difficult to talk about what was prevented in the first place. This is an important measure to say that if something happens, can we intervene in a way that prevents it from happening again? And the re-abuse rate within 12 months is 10%, and within 6 months it's 6.4%. And these numbers have gone down over the past 10 years, which suggests that children today are safer than they have been at any time. Next slide. So I've given a little, some national context, but let's look at what, again, just very high level, very brief, the data for Idaho from the Federal Child Maltreatment Report from 2015, which is the last year that it was published. So in 2015, 12,233 children received a Child Protective Services investigation in Idaho. And that figure, for those of you who are feeling overwhelmed, is up 36% from 2011. That's a much larger increase than what we saw nationally. 36% increase over 6 years over 5 years is quite remarkable. 1,623 of those children were confirmed as victims of abuse. That's up 10% since 2011. Meanwhile, the number of children in foster care in Idaho has been relatively stable over the past few years, with a little over 1,300 children in care at the end of September of 2015. And that rate is, the rate of children per 1,000 is 3.1, which is about half the national rate. So in terms of children going into out-of-home care, Idaho has a much lower rate than the rest of the country. And in many ways, whether that's a good or bad thing is dependent on what you're trying to accomplish as a system. But I would argue that the fewer children in out-of-home care, particularly unnecessarily, the better. And I think that that suggests that either you have a set of very robust prevention efforts, which I believe you do, and also that you're able to intervene effectively early enough that even if abuse or neglect occurs, you have the ability to keep families together. Next paragraph, next slide. In terms of safety, Idaho's also doing better than the national average. So your rate of placement is lower, but looking at these measures of re-abuse, you also do much better. So the national rate is 6.4%. Idaho only sees a 3.1% recurrence of abuse within 6 months. So the percentage of children who are re-abused is low and has declined. So again, I think congratulations to all of you. This is remarkable and a testament to the great work being done. Next slide. So as I said earlier, some of these numbers may sound familiar, and they tell us where we are today in some ways. But at a national level, and as I gave the history, suggested that this child rescue mentality was part of what undergirded the work that we do. The federal government spends about $4.8 billion a year in foster care. So in maintenance of children in foster care. By comparison, about $650 million, so 4.8 billion, 650 million is available to be invested in practices and interventions aimed at strengthening families and keeping children at home when safely possible. And remember, we saw the trend line for out-of-home care going down, but the numbers in terms of dollars have not reversed. So we aren't spending more on preventing children from entering care, although we could see the potential impact of a reduction in the number of kids from the last few years. So nationally, for every $7 available for children in foster care, only $1 is available to invest in preventive services. That ratio holds true here in Idaho, just in Idaho as well. Idaho received $17 million in federal foster care funds in 2014 versus $2.4 million in funds that could be used to prevent child abuse and neglect. So 17 million versus 2.4 million. I recently read about the Office of Performance Evaluations report that was released last month. And the report found that Iowa child welfare faces a worsening shortage of foster parents, challenges retaining its social workers, insufficient infrastructure support, and a joint legislative committee unanimously passed a budget that includes financial and staffing increases. And it's certainly encouraging to see that. I think the more that's invested in prevention will actually have a bigger impact than many of the investments that are being made. And I'll have a chance, hopefully, to continue to talk about that as we go through the rest of this presentation. Next slide. So that's where we are today. In spite of the improvements, at a time when an estimated 4 to 8 children die each day at the hands of their caregiver, I think we can all agree that there's more that we can do. So why isn't our current approach to child welfare making things better for children and families? If you remember back to that child fatality chart, the numbers stay almost identical since 2010 nationally. So why aren't we making things better? Well, let's look at and think about the typical response to a child fatality. The response to such a tragedy often looks like this. First, we hunt for who's to blame. Second, we fire the caseworker. Third, we fire the director, pass some legislation, and then implement reforms. And you see this happening over and over across the country. And if that happened one time and the reforms were put in place and everybody felt that they were making a difference, that would be great. Unfortunately, this cycle happens every time there's a child fatality. And so the reforms don't have the time to stay in place. In many cases, people feel like they are overwhelmed with new initiatives and continue to redo the work over and over. I don't know, does that ever happen here in Idaho? I see a few nods, okay. Well, this defensive response leads not only to leadership and staff turnover, but in many places to also increase removals and placement in foster care. In other words, we continue the child rescue mentality that equates removal with safety. And yet, there really isn't evidence that foster care as we use it today is safer for children. In fact, it's associated in some cases with poor long-term outcomes. And I want to be clear, I don't believe that has anything to do with the foster parents as much as it does with the system that we've put in place, where if foster care were being used as a short-term intervention to keep children safe until permanency was found, I think we would see much better outcomes. But using foster care for 10 years as family goes by is simply unacceptable. And I think that's the kind of the kind of results that we get from the current foster care system. For example, we know that children who are placed in foster care have a disproportionate rate of mental health disorders, including post-traumatic stress disorder. They complete college at a very low rate, often experience difficult employment and financial situations, including homelessness. Now, we've also seen advances in brain research that show that prolonged or toxic stress can physically change children's brains and affect how they learn and behave. We know that the number of adverse childhood experiences increases, that as the number increases, so does the risk for certain health problems later in life. And it's that kind of research that should be driving us. But we're still, in spite of these advances in understanding, responding to vulnerable children like we did in the 1960s. So I have a few ideas about how that could be different. So some of you, now all of you know, but some of you before this were familiar with the the United States Commission to Eliminate Child Abuse and Neglect Fatalities. And I was very fortunate to be asked to chair the commission. And it was a 12-person commission that was appointed by Congress and the President. There were 6 appointees from Congress and 6 appointees from the President. And this was the last administration. So you might imagine that Congress that is both houses, that has both houses dominated by Republicans and a Democratic president would make very different appointees, and it would be a very diverse commission. And that would be an understatement. But I think that the work that we had the opportunity to do, I say often that I wish I knew today what I knew when I was a child welfare director. And I think actually very few child welfare directors have had none have had the opportunity to travel around the country and to hear what happens in ways that really will have a lifelong impact on me and have driven a number of the comments that I will make from this point forward. The commission was asked to develop a national strategy to reduce and/or eliminate child abuse and neglect fatalities. We were asked how to improve the measurement of those fatalities, and I'd just say Reader's Digest version is, we actually don't know the number of children who die in this country due to abuse or neglect because of variation across states, because of the questionable decisions that are made by coroners in deciding the cause of death and a variety of other things. But so we were asked to make recommendations on those and asked to recommend the kinds of strategies or programs that could be implemented to reduce fatalities. We started in 2014 and completed our report last year. Let me just touch on a couple of things from that were really my impressions before going into 2 areas in a little detail. So first, I was amazed. How many people in here are somehow connected to the child protection system, either through reporting or work? So a good number of people. So one of the first things for me was that the single biggest predictor of a later child abuse or neglect fatality is a call to the child protection hotline. And that's regardless of the actual decision that's made at the hotline. So it is a call that is the single best predictor. Now that was shocking to me, because I've administered systems, and the idea of screening out calls, the fact that we would send workers out and decide that no maltreatment occurred, were all part of the work that we did. But what this suggests is that the risk for a number of people who are screened out is just as high as the risk for people who are screened in. Idaho screens out about 54% of calls at the hotline. So it's a question that I think we all have to ask. Second, which was, again, I should have known this, but to see it so starkly presented, is the risk to young children. 50% of the child fatalities are with infants, children under age 1. 75% for children under age 3. 81% children under age 4. But if we look at the policy and look at the response of most systems to an infant who is called in for a child protection report, it's almost identical to the response of a 16-year-old. And that's because it really is driven by legislative policy and not necessarily by research. And so the jurisdictions I was also responsible for, Hennepin County, which is Minneapolis and suburbs, for about 10 years. The jurisdiction response is basically the same. You go out, you investigate, you complete a safety and risk assessment, and you move forward from there. I'm going to come back and talk a little about this issue of young children, but one of the questions that I was left in the commission report is, why would you ever screen out an infant? And it's a tough call because people have been quite critical, certainly of me. Do you really want to send child protection workers out? It's a drain on resources. I don't know. I mean, you have infants who are being heinously abused and being screened out without being seen. I think it's a question. I'm not sure that the response is a child protection worker going out, but I think some response is demanded. A third area is a reliance on one agency, the Child Protection Agency, and this gets to the theme of this conference, doesn't work. You cannot have one agency respond to abuse or neglect and expect that children are going to be safe. And I'll give a couple of reasons for that. One, 50% it's hard to know for a variety of reasons, but I'll use the number 50% because that's what we pretty much came to as a consensus as a commission. 50% of the child fatalities nationally are known to the Child Protection Agency. 50%. 98% are known to a primary care physician. So almost every child that dies is known to a primary care physician. But when we think about how the health system and Child Protection Agency work together, the way it happens in the communities I was part of is if a physician saw abuse or neglect, they made a report. That was their responsibility, to report. There's very little else that they did other than make a report. And that's because the law in the Child Protection Agency said, don't do any more. We'll take it from here. Doesn't work. And then finally, the last piece that I'll just touch on in terms of my own impressions was the potential importance of predictive analytics. And I'd never heard of predictive analytics other than baseball. And those of you who are baseball fans know that some people use a lot of data to make decisions about who should be hired, who should be brought onto your team and where they should bat and so forth. Well, we had a chance to actually get immersed in how the airline industry has addressed safety. And I would just say there are many similarities. There are clearly differences, but many similarities in that the airline industry in the 60s functioned in many ways the same as the Child Protection Agency does. Waited for accidents to happen and then tried to figure out what the cause was and who was to blame. What they found is that that didn't work. And that in fact, a prevention effort, a prevention strategy that really looks more at where the risk is and addresses that risk versus waiting for crashes to happen and trying to figure out who is to blame was far more effective. And I would say, for me, that was quite a story about, quite compelling in convincing me that the same approach needed to happen in child protection. We can't wait for children to be abused. We can't wait for children to die and then figure out what went wrong. We have techniques today that tell us who's at risk. We have interventions that work. We need to use those to make sure that children are never abused in the first place, and if they are, to intervene as quickly as possible to make sure that they're healed and their family is brought together. And we can do that. So let me talk just a little about some of the commission reports, and then I'm going to turn it over to Maritza. So a couple of things that the commission recommended. One is there's an approach that was used in Florida that touches on what I just talked about with, oh, next slide, Marty. That talks about a predictive analytics approach that really looks at the children who died over a period of time. What are the differences in characteristics between families where children die as a result of abuse or neglect and where they don't? And begin to apply those as decisions are made today, and not so much in new policy, but really looking at how do we provide supervision and how do we work together differently. And I will not go into detail right now, but if there are questions about that, I can certainly direct you to where to find answers, and some I can provide. Second, the Commission felt very strongly that this issue of young children and the vulnerability of young children was critical. Children from birth to age 5 with a prior maltreatment allegation are more than 2.5 times as unreported children to be fatally injured. So the Commission recommended that every state review its policies on screening, especially reports for young children. The final couple of things that I'll touch on, for young children, particularly for children under age 1, the Commission recommended that a child protection worker should never go out alone and investigate a child in a family under age 1. And I think that raises questions about what is the connection between the prevention services and child protection agency. When I was in Los Angeles, we actually worked to team prevention agencies with child protection workers in going out to investigate for children under 1. The prevention agency certainly wouldn't do the investigation, but would be there right away to offer services to the family. Because going back to what I said earlier, we have a system that's not designed to deal with most of the families that are coming to the attention of the system. That most families who come to the attention want services. And if they're connected to services, there's a way to provide them much earlier. The final thing that I'll touch on is the Commission recommended that funding be reconsidered. And the Family First legislation that was introduced last year in the House and Senate passed the House, failed to pass the Senate by a couple of votes, was one of the strongest recommendations from the Commission, that legislation pass. So, next slide. So let me just close on the big part of the recommendation, which is to a 21st century child protection system. That what the Commission recommended is that we rethink child protection from a rescue-focused intervention to a public health approach to child safety that includes a broad spectrum of community agencies and systems. So I'm going to just spend a few minutes talking about what a public health approach might mean. A public health approach for child safety is one that promotes the healthy development and well-being of children. And I would just emphasize that this isn't just about prevention agencies and services. This is also about child protection agencies. It's about law enforcement. It's about the courts, because everybody benefits if children aren't abused or neglected in the first place. It starts with changing attitudes, beliefs, and behaviors, then focuses on prevention and supportive community conditions. Rather than focusing on treating individuals, a public health model works on a population level to look at and to shape patterns across the entire community. So let me give one example, again from the Commission. So everybody, I think, has heard the risk of teen parents, the risk that teen parents face in terms of involvement in the child protection system. Well, it turns out it's not quite so simple. That actually what we found is that teen parents who were involved as youth, as young people in the child protection system are at much greater risk of later involvement in child protection as parents than other teen parents. As a matter of fact, almost 50% of teen parents who were involved in child protection as children will have an open child protection case by the time their child is age 5. Almost 50%. So we know that. I would submit we should expect to do something about that. I would guess that if you ask most child protection agencies how many teen parents are on your caseload, they'll struggle to know. So how do we think about addressing a population that we know is at risk versus waiting for them to get involved before their child is age 5 as a parent in the child protection system? That's the kind of thing that we need to begin to think of differently. Rather than waiting for somebody to report the teen, is there something that we can do to offer supports as a community? Next slide. So this is a model from the CDC, Center for Disease Control, that really talks about a public health model. The first, to define and monitor the problem. Second, to identify risk and protective factors. And the protective factors piece is important because I know many of you as providers of prevention services are very used to focusing on the strengths of families. In the child protection system, that can be very difficult to do. And so how do we think collectively about what are the protective factors necessary to inoculate children from being harmed? Third, develop and test prevention strategies. And finally, to ensure widespread adoption. And so this really begins to define what a child protection agency and what a child welfare system might look like into the future. I was asked in front of one of the congressional committees about, so are you saying that more children should be served, but the Child Protection Agency should actually serve fewer children? And the answer to that is yes. That's essentially what the commission is saying, is that as communities, we need to think about how this is a full system. It's not a separate set of prevention providers and healthcare providers and child protection agencies and law enforcement. It's what do we want to happen for children in this community? And how do we weave all of that together in a way that allows everybody to do their job more effectively, but first and foremost, keeps children safe? In talking about keeping children safe, I'm always struck by the idea that in child protection, safety is making sure children aren't re-abused. Now, a child can be tortured almost to the point of death, but as long as they aren't involved in the child protection system, that's not considered unsafe. The safety is, are they re-abused? How crazy is that? That's where the notion that Roger talked about, that we're all in this together, is absolutely critical. The last thing that I'll touch on, and then we're going to go to a couple of videos, is this is doable. That's what the commission concluded. That first, the approach that we're using now can be improved. And there are improvements that can be made, some of which I touched on. But we're not going to get to a goal of 0 fatalities using the approach that we use right now. We really need to rethink that. And so we've been doing a lot of work at Casey Family Programs in trying to invest in communities in some different ways. And we talk about building communities of hope. We're referring to communities that build partnerships among all parts of the community to support children and families. And so we have a short video that talks about Johnson County, Kentucky, which is in eastern Kentucky and has seen the number of children in foster care reduced by 1/3 by involving the community, not by hiring more child protection workers, but by involving the community in a different way.
I always get teary at the end of that. It's weird seeing someone do a video of your family and to hear myself talk about my struggles, because it doesn't happen very often. I just want to say thank you for being here, and I'm very happy that Casey thought of me and invited me, and I'm always willing to share my story. I think that it could be inspiring, but also I'm this success story of the foster care system and a foster care youth Um, and although for me, I do see where I could be a success, but I think that every day is a challenge for me. And until speaking about prevention, when I talk to, Bubba, my ex-social worker, I think that the real success for me will be when my children are older, when they're 18, when I could say that I was successful with my children. I could have a PhD, and for me that won't be success, because for me every day is about prevention. The first 16 years of my life were very hard. There was a lot of neglect, physical abuse, emotional abuse, and towards the end, sexual abuse. It was very difficult. And hearing the statistics in Idaho, where there's over a 50% chance that child, when we call and file a report, that it's not even gonna be, no social worker's gonna go and see what's going on. For me, that was a reality. I had at least 3 different calls reported from family, from teachers, from the community, and I don't know, this was years ago. In a way, yeah, I do feel that I was failed. Maybe my family was failed, but there's such limited, resources, such limited fundings, that I now as a social worker could see how I fell through the cracks. I think that my family, looking back, my family being Mexican, we're a Mexican family. I was born in Mexico. We were very closed off. My parents were both employed, and in a way, we were kind of the family that other families looked up to. My parents had this, our community, from our family, they felt that if they needed help, they would turn to our family for help. And so my family didn't ask for help. We wanted to be that perfect Hispanic family in our community. But behind closed doors, we were struggling in a lot of ways because we didn't ask for help. Because my parents didn't ask for help. And I'm not my parents, so I don't know why they didn't ask for help. I don't know if it was a pride thing. I don't know if they really thought that they were raising their children the way they believed was 100% right. But looking back at the abuse, I know, and that the way that they were raising us was not the norm. It was not, it was just not acceptable, the way that we were being raised. When I went into foster care, I was 16, so I was a teen. I had a lot of doubts. I didn't know if I had done the right thing about reporting the abuse that was happening in my family. I was living with strangers. I didn't know if, in this weird way, even though with all the abuse happening at my home, I didn't know if my foster parents or my social workers could love me the way I thought my parents loved me. And I think that as the social workers here working with children, we see that no matter how abused a child is, their parents are the best thing in the world, and they want to go back to them. And that's essentially the abuse, the neglect. It all becomes normal for us, and that's our normal. That's what we know, and that's where where I felt comfortable after a while. But I was blessed, and a social worker for the Department of Health and Welfare, they saw something in me, or maybe that was just their standard of referring me to Casey Family Programs. I didn't know what Casey was, but I was referred to Casey Family Programs and placed within their services, which really helped. With the Department of Health and Welfare, you guys have a big caseload. Sometimes that monthly visit, that's the only time you see your foster youth or your foster children. And with Casey Family Programs, because they do have a smaller caseload, I was able to get more on one, just work, more case management, I guess you can say. And I was able to be given more opportunities, more support. The foster families that I was in, I think they helped with prevention for me. They were able to model appropriate punishments, appropriate, what an appropriate 16-year-old should be like. I remember my foster dad always telling me, stop being a mom, because I try to be a mom to my little brother and sister. And they would say, you go be a 16-year-old, go get in trouble, go hang out with your friends, go get a boyfriend or something. And for me, that was so different. That was so liberating. Because being a 16-year-old with my biological parents was very different. It was being a caretaker, learning to be a caretaker, being there to serve my father, being there to serve my mother. And all of a sudden having all these liberties was rewarding. And it wasn't only with them. I also was with another Latina, I had another Latina foster mom, and she was from Nicaragua. And it was awesome because we would speak Spanish in the house. It didn't feel so far from my life with my parents. And she also provided appropriate modeling. And the time she would spend with me telling me what is appropriate for a young Latina woman to do, and that was awesome, because I was able to compare that with my Mexican family and say, there are some similarities, but there's also some differences. And at such a young age, I had the insight to know that I didn't want to be like my parents. And I think that we all say that growing up, like, oh, I hate you, I don't want to be like you. But for me, it was different. For me, and I think for foster youth, it takes it to a whole new level when we say we don't want to be like our parents. And that's where prevention really comes in, because we know that foster youth leaving the foster care system, that we age out, that we don't get adopted. We age out, and a lot of us are homeless. A lot of us are pregnant before the age of 21. A lot of us turn to opioids, drugs, alcohol. A lot of us don't graduate from high school, don't even get to the opportunity to go to college. And at 18, our safety net of the state is really taken away from us. And it feels awful not to have a safety net. When you have your parents, or I see other acquaintances that I have, and they have a safety net, even if they're 40, they're like, well, I'll just move in with my mom. I will never have the privilege to say that, to say, oh, well, if I fail in life, there's always my mom I can turn to. And it's hard. But knowing that, foster youth by the age of, ex-foster youth by the age of 21 will have children, that they might not be employed, that they might not have education, that's where we start seeing these life stressors and this cycle that starts to come back. So for me, prevention really starts, with youth, with children that are in foster care. If they're not going to go back to their parents, and parents' rights have been terminated, and they're not being adopted, you kind of feel unwanted. And once you're 18 and you leave the system, you don't really know where to turn, who to turn to. You don't know what kind of help is available. You don't know who to ask for help. And you don't know what you don't know. So for me, I just feel that I was lucky. I had great social workers, even if they were overworked. I had great foster parents, and I had Casey Family Programs that was there as a safety net until I graduated from college. But a lot of the youth don't. And prevention really starts, the education for foster parents, and it starts with individuals like you. It starts with, if you only could make it, to a visit with a youth one time per month, really make it worth it, that one time per month. Really give the youth something to believe in. And that one visit per month can really make a difference for the youth in foster care, but also for the foster parents, because it's hard and they're overworked. One of the foster families that I was with, they were outnumbered. They had like 7 kids in the home, 3 of their own, and then the rest were foster kids. And their marriage didn't last. It was maybe 3 years later, and they got a divorce. And the husband, he said that taking care of being a foster parent, really, that for him, he said that was his deal breaker in a way. It was just too much stress. And it is a lot of stress. Being my nephew, who's 19, he still lives with me, and he came to my household when he was 15. His sister was 14, and my niece, the youngest, was 6. And that was really difficult. We went to pick them up in Mexico. They're U.S. citizens, and we opened our house to them. And it was very difficult after the honeymoon period of a couple months. The real challenges set in. I had to look for mental health providers for them. It was nonstop scheduling, from doctors to activities to counseling appointments, and that could be very challenging. It could be very stressful, and I did sometimes lay in bed a lot, actually, and think, is this even worth it? Am I even making a difference for them, and why am I even doing this? Because it doesn't seem like they appreciate it. But I think that's with teens and children, even your own, you wonder if what you're doing is right. I didn't have with my family, they never entered the foster care system. So I didn't have that support to look to a caseworker and ask, hey, am I doing this right? I reached out to Casey Family Programs, and I continued, I staffed a lot with them. Me taking the internet away and, taking the modem off the wall at 10, is that normal, or is that like too much? And I was able to staff a lot because I had this community. I had support, and they were able to refer me. But then there's a lot of families that don't have support, and they don't know who to turn to. And maybe taking the modem off the wall, turns into, more physical punishment or just some neglect. And for me, it's so I have seen the abuse. I have experienced the abuse. I have been to the point when I was a child thinking, I think it's better if I just don't exist anymore. So for me, it's so easy to see how my parents, they could be so loving, one day and the following day just be so abusive. I don't want to be that. And it's an everyday struggle that when I go to bed and I wake up in the morning, I think I want to do what's best for my children. And that's going to be my success in X amount of years, is just making sure that I never cross that line. Because we all think, some people think like, how could you cross that line? But you can cross that line from punishment to abuse. And it's knowing when to stop yourself when you're right there and ask for help. And caseworkers, you guys might be the ones that they call and being able to provide and be a listening ear. And sometimes that's all it takes, is being on that phone for an hour and just, providing listening skills and just being supportive to help somebody de-stress. But I think that prevention needs to start with the youth in foster care, troubled kids that are in school. There's, that video that we're all a community, and it's true, we're all a community. If you have, children, their peers are part of their community. Idaho, Boise isn't really that big. We think it's big, but it's not. And we run into people all the time. And it's always, as a social worker, it's how can, at least for me, it's how can I help? Even if I only have a little bit, what's something that I can offer? So, yeah, I think that I'm trying to think what else I can say. I had this all really well prepared in my head. But, being social workers and providers, we don't get those thank yous very often. It's a thankless job, and but it's a job that at least for me, it warms my spirit, and it makes me feel, at least I feel like I'm making a difference. And you have to give yourself a pat on the back, and you have to tell your peers thank you, and you have to reach out, because even Casey Family Programs, they have a lot of funding compared to other agencies, and they still reach out to their community members and make referrals out. So as providers, we also need to reach out and see where else there's more support. And Bubba, thank you. And thank you to everyone who's here and is willing to learn and expand our horizons and help with prevention.